In this podcast episode, Dr. Karan Rajan, a gut surgeon turned health educator, discusses a wide range of topics related to gut health, women's health, and preventive medicine. Drawing from both his personal health journey and professional experience, he sheds light on the often overlooked connections between fiber intake, gut microbiome balance, and chronic conditions such as endometriosis, PCOS, and menopause symptoms. The conversation also covers bowel health, the challenges of medical education on preventive care, viral health misinformation, and practical advice on improving diet and lifestyle. Dr. Rajan highlights that many common female health problems, including heavy periods, menopause symptoms, and diseases like endometriosis, can be linked to low fiber intake and gut dysbiosis, a disruption in the gut microbiome. He explains that hormonal fluctuations, pregnancy, and menopause uniquely affect women's gut health because estrogen receptors are present in the colon, causing symptoms to worsen with hormone changes. Women also tend to have longer colons and more diverse gut bacteria, yet they are predisposed to a higher risk of gut issues, partly due to these hormonal cycles. Importantly, while symptoms such as heavy periods are common, Dr. Rajan emphasizes they are not necessarily normal and should be tracked and discussed with healthcare providers, urging women to keep detailed symptom diaries as data that cannot be easily dismissed. The podcast delves into the epidemiological evidence linking higher fiber intake with reduced gastrointestinal symptoms in women with endometriosis. Specifically, low FODMAP, gentle fibers, appear to alleviate bloating, constipation, and pelvic pain associated with this condition. Fiber is presented not only as a tool for regular bowel movements, but also as a key factor influencing estrogen metabolism. Certain gut bacteria untag estrogen, allowing it to re-enter circulation, which can exacerbate hormone-related issues such as heavy bleeding and potentially increase breast cancer risks. Soluble fermentable fibers help bind and escort excess estrogen out of the body while also promoting a healthier microbiome balance. A detailed explanation is offered regarding the interplay between dietary protein and fiber. Dr. Rajan notes that most protein digestion occurs in the small intestine, but excess protein can reach the colon and be fermented by gut bacteria not adapted for this fuel source. This fermentation may produce harmful compounds, damaging the gut lining and contributing to leaky gut symptoms. Fiber, as the preferred energy source for the gut microbiota, supports a balanced and healthy bacterial environment, underscoring the importance of moderating protein intake and ensuring sufficient fiber consumption concurrently. Dr. Rajan shares his own health scare as a young surgeon when routine blood tests revealed high cholesterol and fatty liver disease, conditions he linked to a high-protein, low-fiber diet. This personal experience propelled his deeper interest in gut health and the microbiome, a topic rarely covered in medical school. He points out how medicine remains largely reactive, focused on treating disease late in its course rather than preventing it. In his surgical practice, particularly with colorectal cancer, he has observed increasing cases in younger patients and advocates for lifestyle-driven prevention, especially boosting fiber intake and participation in screening programs. A recurring theme throughout the discussion involves embarrassment and stigma around gut health topics. Many patients, especially women, hesitate to discuss bowel habits, symptoms like constipation or bleeding, and menstrual issues with doctors due to shame or discomfort. Dr. Rajan stresses the potential severity of hiding symptoms, which can delay diagnosis of serious conditions. He encourages an open, data-driven approach when visiting healthcare providers, advising patients to approach consultations armed with detailed logs to avoid being dismissed or gaslighted. Patients are urged to be proactive during medical checkups and persistently report chronic or worsening symptoms that affect quality of life, from acid reflux to constipation and bloating. Dr. Rajan underscores that common symptoms should not be normalized or ignored, and that maintaining a symptom diary gives practitioners concrete evidence difficult to refute. Both men and women should prioritize this, although women face additional challenges related to cyclical hormone changes and reproductive health issues. The episode challenges outdated fiber recommendations of around 30 grams per day, presenting evidence that benefits continue to accrue beyond this amount. Dr. Rajan cites the Hadza tribe of Tanzania, who consume up to 120 grams of fiber daily from diverse, slow-fermenting sources like roots, tubers, beans, corn, and cassava, all crucial for nourishing beneficial bacteria throughout the entire colon. He contrasts this with typical modern diets that rely heavily on fast-fermenting fibers found in fruits like apples, which fail to support gut microbes residing deeper in the colon. Dr. Rajan shares his routine of consuming fiber-rich breakfast staples, such as oats, chia seeds, and berries, combined with a specialized soluble fiber supplement that provides 10 grams per serving without altering taste or texture. This supplement is heat-stable, allowing flexible use in hot beverages, baking, and various meals. He recommends a gradual increase in fiber intake to avoid gut discomfort, highlighting that consistent supplementation alongside a fiber-rich diet can help bridge gaps when busy lifestyles make food preparation challenging. The discussion covers what constitutes healthy bowel frequency and quality. While passing stool anywhere from 3 times per week to 3 times per day falls within the normal range, Dr. Rajan emphasizes stool consistency and ease of passage are equally important. He references the Bristol stool scale, explaining that ideal stools resemble a smooth sausage shape, while small pellet-like stools indicate constipation and watery stools suggest diarrhea. He notes even daily bowel movements can accompany constipation if the stool is hard or difficult to expel. Constipation, Dr. Rajan explains, is often multifactorial, primarily due to low fiber intake, but also affected by hydration, physical inactivity, and even sleep patterns governed by circadian rhythms. He describes intestinal jet lag caused by disruptions in biological clocks, such as crossing time zones, which impair gut motility and hormone release, leading to constipation or diarrhea. He also touches on the constipation side effects of GLP-1 medications, which reduce appetite and slow gut motility, necessitating adjusted fiber and protein strategies. Dr. Rajan is skeptical about certain popular health trends, such as coffee enemas, emphasizing potential harms from acidic coffee, irritating delicate colon tissues, and noting rare but serious injuries like colon rupture. He stresses caution with probiotic supplements, advising consumers to check for specific strains linked to particular conditions, rather than relying on general-purpose probiotics that lack proven benefits. He prefers that people focus on feeding their existing gut bacteria with prebiotic fibers rather than continually planting new flowers with probiotics. The guest highlights the importance of early life microbial diversity in shaping lifelong health, including immune function and allergy risk reduction. He describes evidence from the LEAP trial supporting early introduction of potential allergens like peanuts to reduce allergy development. Exposure to pets, siblings, and diverse diets in childhood also promote a resilient microbiome. He shares personal anecdotes about feeding strategies for children involving introducing varied textures and foods like bone marrow and liver to encourage microbiome diversity and healthy eating habits. Dr. Rajan stresses the importance of simplifying complex medical information so it is accessible to people with varying educational backgrounds. He carefully vets collaborators and content to ensure alignment with scientific evidence and consistency with expert consensus, avoiding exaggerated claims and black and white thinking. His focus remains on nuanced, evidence-based education that empowers people to make informed decisions without fear or confusion. His recently published book addresses taboo or overlooked subjects ranging from period and menopause issues to cancer and patient advocacy. Designed as a reference rather than a straight read, the book provides practical advice for difficult conversations with healthcare providers. Dr. Rajan likens the human body to a complex but glitchy machine, underlining the importance of sleep, gut health, and circadian rhythms as foundational pillars that influence a wide array of symptoms and conditions, including mental health and skin disorders. Dr. Rajan's educational content is available widely on social media, helping millions better understand gut and overall health. He also offers a fiber supplement product that delivers a diverse blend of fibers, 10 grams per serving, designed for taste neutrality and versatile daily use. Listeners are encouraged to incorporate fiber gradually and consistently, stacking the habit with existing routines such as morning coffee or evening magnesium water, for lasting health benefits.